This is Dr. Lauren Mell, Radiation Oncology at University of California, San Diego. This is an instructional video for normal tissue delineation for the International IMRT protocol. We'll discuss in this video bowel, bladder, and rectal contouring. The first contour we'll go over is the bowel. We're looking at a CT simulation scan for a patient with stage 2B cervical cancer. Outlined here is the topmost slice of the planning target volume at the inferior border of the L4 vertebral body. This is a reference point for the bowel contouring. The bowel should start at 1 centimeter superior to the uppermost slice on which the PTV is it comes into view, which is here. This patient was imaged at 2.5 millimeter slice thickness, so we'll proceed superior for 4 slices, 1, 2, 3, 4, to begin the bowel contouring, and we will have the bowel contoured already here, but just to go over the technique, we contour the outer loops of the bowel around the peritoneum. We don't contour in the any individual loops of bowel, and we proceed all the way around the outer loops of the bowel like so, and we contour about every third slice and then interpolate. So we can see this proceeds down and we follow around the outer loops of the bowel down to the most inferior point in the pelvis. The part in light blue here is the clinical target volume. The in red is the planning target volume, and in blue is the bowel. So the bowel may dip into the planning target volume, but it won't overlap with the clinical target volume because we will remove any part of the bowel that extends into the CTV. It's also important to note we keep the bowel contour anterior. We don't follow the bowel posteriorly into the pelvis because it'll just be well within the target volume anyway. So we only contour the portions of the bowel that sit anteriorly and not behind the uterus, and so that covers the bowel contour. The bladder and rectum are pretty self-explanatory, but in this case we'll show the bladder contour, which comes into view here. I'll turn off the PTV so that we can see what the bladder is here. The patient was simulated with an attempt at an empty bladder, and although there's still, as you can see, a fair amount of bladder tissue here. So there's the bladder contour. Again, we will take the, except for any part that extends into the CTV we'll exclude, and you can use a Boolean operator here if you're using Eclipse or a comparable tool in another treatment planning algorithm, and you can just subtract any part that extends into the clinical target volume. And then the rectum, it's just important to note that the rectum should extend about from the anal canal here superiorly. Again, it shouldn't cross into the clinical target volume, and we'll contour the rectum all the way to the sigmoid flexure here. So that's the technique for rectal, bladder, and bowel contouring for this protocol.